Hello, and welcome to the Lake Health Diabetes Education Program. My name is Marjorie Lang, and I'm the Diabetes Education Manager of the Diabetes Education Services Program here at Lake Health. The program focuses on diabetes management for those with the condition of prediabetes, type 1, type 2, as well as gestational diabetes. Today we present to you this video which discusses some of the important topics in diabetes self-management. Our team of talented diabetes educators and certified health coaches are comprised of registered nurses and registered dietitians who can help you with lifestyle change to improve outcomes related to your condition of diabetes. Contact our department today to schedule a diabetes class or an individual assessment. We look forward to working with you during this time, and if you have any additional questions or concerns related to your diabetes diagnosis, please feel free to give us a call. Thank you.
Hi, my name is Susan Check. I'm a registered dietitian. I'm also one of the diabetes educators here with Lake Health. And today we're going to talk about glucometer training. Meters are very important in helping us to be able to manage our blood sugars because we can't make differences if we don't know where we stand. So I'm going to go over what a meter looks like and how to use it appropriately. Most standard meters all look pretty much the same, and so this is what I have in front of me. There are four main components to meters. The first is the actual meter itself, your strips, which is what you put the blood on, your lancing device, which assists you in obtaining the blood sample, and last but not least, the needle, the thing that most people are afraid of. So we're going to go about instruction on how to set your meter, and it's important to set your date and time on your meter. The meter will come with instructions, so if you have, most of the time you can kind of walk through it, but if you're having issues, I suggest refer to your manual as a guide on how to set the time and date. It's important to set the time and date because if you're not writing your numbers down on a log and you're just letting the meter track them, you want to know, well, what date was this and what time did I take my blood? So setting the date and time is very important. Most meters can turn on in one of two ways. Most meters have a round a button that's got a round circle on it. If you press and hold that, it'll turn your meter on, as that happened. This actually talks to you. Or if you put the test strip in, it will also turn your meter on. So those are the two ways that the meter will turn on. The test strips. Now these test strips are light sensitive, so you want to keep them in their container until you're ready to use them. They're also somewhat temperature sensitive, so you don't want to keep them in your steaming hot car, or if it's freezing cold, probably not a good place to keep your strips. Keep them in a room temperature area. The lancing device. The lancing device all works pretty similar. There's a mechanism by which to cock the machine and a firing device. So on this particular one, when I pull this back, it cocks the machine, and when I hit that button, it fires it. Some lancing devices look a little different than this. In some, you have a unit that kind of pulls back, that cocks it in place to fire it. And others, if you just, like on a pen, if you just push the one end of it, kind of like you would push on a pen to start writing. So depending on what kind of meter you're using, those are the areas you kind of want to look for in order to cock the machine. It's important that that machine gets cocked, because if it doesn't, you could press this 15 times and it's never gonna fire to get the blood sample. So just be mindful of that. Now, on most of these lancing devices, we have a dial that goes on this particular one. It goes from 1 to 5, and all that does is indicate how much of a force we want the lancing device to have. Some people have very calloused fingers and they need a more forceful poke. Some people have very thin skin and don't need a forceful poke at all. So the higher the number, the stronger the the poke is going to be. So if you're I generally tell most of my patients to start in the middle and go from there. If you find in the middle that you're trying to get a blood sample and it's just not doing it, then you can bump it up a little bit. Now, in order to use this device, we have to get the needle in it. The needle, they all look pretty similar, okay? You're going to find that there's going to be a round top on these needles, and that's where the actual needle is. So to expose the needle, you want to twist this round plastic thing off. Eventually it'll pull right off, and that'll expose your needle. We'll be doing that in a second. So in order to get the needle into the lancing device, a couple different ways you can do it, depending on what your lancing device looks like. On this one, I just have to turn it like I'm turning off a cap, okay? And that takes the cap off. On some, you just pull it apart. So depending on what yours looks like, try those two things. So in mine, I just have to turn it off, and I place the needle in the little holder, and I'm going to expose my needle, okay? And now I have to put the cap back on. So I'm putting the cap back on the same way that I took it off, screwing it right back in, okay? So now we have our needle in its place, okay? Our meter has been set with the appropriate time and date. The next thing we have to do is we have to make sure that our hands are clean, okay? Probably you want to do that first. Soap and water, best way to wash your hands to get them clean, make sure they're dry. Now, if you happen to not be around a sink, you don't have that availability, an alcohol swab will definitely do the trick. The thing about an alcohol swab is that when you're using an alcohol swab to clean your hands, you have to take an extra step when you're obtaining a blood sample, okay? Because you don't want to test on the first drop of blood if you're using an alcohol swab to clean your hands. You don't have to do that step if you're using soap and water to clean your hands, okay? So that's first. If your hands aren't clean, it could definitely throw off your number, okay? So with meters and strips, as I said, when you put the strip in, it generally turns your meter on. How do we put the strip in? Well, you got to put the strip in the correct way. Strips have two sides, okay? One generally is either completely white, or in this particular case, it's looks very computery, okay? That's the bottom side. The top side has a component that actually goes into the meter itself, and the other component is where the blood sample goes. Sometimes patients think that they have to drop the blood right on top of the meter strip in order for it to read, and that's really not true. These strips are designed such that when you obtain your blood sample, all you have to do is put the tip of this right up to the blood sample, and it sucks it in kind of like a turkey baster would suck something in. It automatically just sucks it right into where it needs to go, okay? So don't waste your time trying to drop blood on top of the strip. Chances are it's not going to take a good reading, okay? You want to just bring the sample right up to where the blood is, and we'll show you how to do that in a second. So once you get all prepared, and I say get all prepared because once you put the strip in, you got about maybe 1.5 to 2 minutes to get blood on that sample, on that strip. If you don't do it in 1 to 2 minutes, the meter will shut itself off and you'll be wasting a strip. Okay, so you want to make sure your hands are clean. You want to make sure that your lancing device is loaded and ready to go, meaning cock it, ready to go, before you put the strip in. Okay, so the one thing that I want to mention is at the end of all this, once we obtain a successful blood sample, we have to dispose of this. This is a biohazard situation now because the strip has blood on it, and the needle itself is sharp. So we don't want to just throw that in the regular trash. It's just not the best way to dispose of things. So I recommend just using an old prescription bottle. It's hard plastic, so the needle's not going to poke through. And most of the time they have these child-proof locks on them so that people can't get in them and mess with nasty stuff. So that's my suggestion, is to put your used meter strips and lancets into just an old prescription bottle. Okay? So at this point now, I think we're about ready to show how this is really done. And so I am not by a sink, so I'm going to use a good old alcohol swab. We're going to make sure it dries. When we're testing, where's a good place to test? Well, generally they say anywhere that my fingers are not touching is a good place to test, meaning along the perimeters of your fingers. And it does not matter what finger you use. As a matter of fact, we want you to use different fingers over time, because if you're testing in the same place over and over and over again, it's going to hurt and you're going to develop some scar tissue, okay? You can test on the pads of your fingertips. It's going to give you a reading, but it's also going to hurt more. So that's why we say anywhere that my fingers are not touching is a good place to test, okay? So I've cleaned off my finger. I've allowed it to dry. My lancing device has been loaded and it's ready to go. Now, the other thing that I want to mention about this lancing device is you have to really butt it up against your finger pretty decently. Sometimes people are reluctant to do that because, well, nobody really likes needles. However, if you don't give it a little bit of pressure at the actual point of where it's going to take the sample, the needle may not reach your skin enough to pierce it, okay? So you want to make sure that you're butting it up against your finger pretty decently, okay? So I'm going to go ahead and I'm going to obtain my blood reading. And as I said, I've got the lancet ready to go. The needle's in there. I'm going to allow my finger to dry. And I'm going to put my strip in. Most meters will tell you when it's ready for blood to be administered to the strip, and this one does that.
Blood glucose test. Please apply blood onto the test strip.
Okay. Not all meters talk to you. This happens to be a fancy one. So as I said, it's cocked. It's ready to go. I'm going to give a little bit of pressure here. Now, sometimes when you do this, you know, when you pierce yourself, you might need to give it a little bit of help, okay? I've got a decent sample size there, but remember I said that when we're using alcohol swabs, we're not testing on the first drop of blood. So I'm going to wipe it away with the tissue. Don't wipe it away with an alcohol swab because you're defeating the purpose, okay? So I'm going to wipe it away with the tissue, and I'm going to test on the second drop of blood. Okay. Now, I have a trick here. I happen to have a decent sample size. However, sometimes people have a really, really hard time getting blood. And if that is you, I suggest taking just a little bit of a rubber band here and wrap it around your finger. It acts like a tourniquet. That takes away that problem in a hurry because generally you have no problem getting enough blood that way. So as I said, we're going to just bring this up there. It's going to suck it right in.
Your blood glucose reading is 106
okay.
milligrams per deciliter.
So that's going to be my reading, and I would write it down on my little glucose log, which we do recommend you do because it's really hard to kind of keep track of your readings, especially if you're testing more than one time a day, if they're all stored in your meter because you have to toggle back and forth, and that gets a little confusing. Okay, so now we've successfully obtained our blood sample. Now we have to get rid of this biohazard stuff. As I said, again, I recommend using an old prescription bottle. The strip itself can just get pulled off and dropped right in there. Now, the needle can be a little tricky sometimes, and this one is helpful because it gives me a little ejector. Not all of them do that. So I'm going to take the needle out the way I put it in. I'm going to turn this. That exposes my needle. Now, I don't necessarily want to go in there and pull it out because I don't want to risk pricking my stuff again. And as I said, this one has a little ejector here where I just can go like this, and it disposes right into my handy dandy prescription bottle. I'm going to cap that, put this back on, and so then most of these meters are designed to kind of carry all of your stuff. So I've got my lancing device, I've got my strips, I've got the meter itself, which is going to shut off on its own, or I can just hit that round button and that will shut it off. And I'm good to go until the next time I have to test. So hopefully this was informational for you. And please keep the Diabetes Education Department in mind if you have any questions. We'll be happy to help.